Hello friends. Today we'll discuss about definition of sepsis, severe sepsis, and septic shock. So, what is sepsis? So, sepsis is your body's extreme reaction to an infection. So, without prompt treatment, it can lead to organ failure or even tissue damage and death. So, sepsis is a serious condition caused due to an infection. What is severe sepsis? Severe sepsis actually generally referred to sepsis with associated acute or multiple organ dysfunction. So when the sepsis with sepsis any acute or multiple organ dysfunction occurs, it can lead to severe sepsis. The main ICD10 codes used for coding this severe sepsis is R62.2 category subcategory. So there are actually two codes which are actually comes under R65.2. So those are R65.21 and R65.20. So R65.21 is severe sepsis with associated with septic shock, and R65.20 is without septic shock. So what is septic shock? Septic shock generally refers to a circulatory failure associated with severe sepsis. So when any circulatory failure occurs with severe sepsis, it leads to septic shock, and therefore it represents a type of acute organ dysfunction. So any organ dysfunction also can occur in septic shock. The physician must specifically record septic shock in the diagnostic statement in order for it to be coded as such. So our physician should specifically mention septic shock in the diagnostic statement so that the coder can capture the DX for septic shock. Septic shock indicates the presence of severe sepsis and code R6521 that severe sepsis with septic shock must be assigned even if the term severe sepsis is not documented. So it doesn't matter whether severe sepsis is documented or not documented. If septic shock is mentioned, you have to code a R65.21 ICD10 code, which is severe sepsis with septic shock for that document, because here severe sepsis does not need its documentation because septic shock code itself includes the severe sepsis in its course description, like here it is given for R65.21. So even if severe sepsis is not documented, you can go ahead and code septic shock code if it is mentioned by the physician R65.21. Now coding and sequencing. So here for severe sepsis you require minimum 2 codes. So for the sequence, first code is for the underlying infection. So we know that sepsis is caused because of some infection. So we have to code the underlying infection, followed by the category of R65.2, which is a severe sepsis. So severe sepsis, there are two codes which we have already discussed, 20 and 21. Severe sepsis without septic shock and severe sepsis with septic shock. One more thing, the code from category R65.2 can never be assigned as a principal diagnosis. So it should not be assigned as a principal diagnosis. It should always be coded as a secondary diagnosis. Primary code will be like the main infection which is causing this sepsis or septic shock. So if the causal organism is not documented, assign code A41.9 sepsis unspecified organism for the infection. So if the organism specified is not given, like these staphylococcus or these other names of bacteria which are not given and not documented, specificity is not given, you can code this unspecified code A41.9 sepsis unspecified organism for the infection. Also assign additional code for the associated acute organ dysfunction. So if any acute organ dysfunction is there, because severe sepsis occurs with an acute organ dysfunction, you have to code the additional code also as well for the severe sepsis. Now here you can see the codes you have to code initially and as the additional code. So for R65.2 severe sepsis, you have to code first underlying infections such as infection following a procedure, infection following infusion, transfusion and therapeutic injection, puerperal sepsis, sepsis following complete or unspecified spontaneous abortion, sepsis following ectopic and molar pregnancy, sepsis following incomplete spontaneous abortion, sepsis following termination of pregnancy, and sepsis not otherwise specified. So if no specified organism is not mentioned, we are coding A41.9. Other than that, if you get anything in this list, you have to code it as primary followed by the R65.2 category code, which is severe sepsis category code. Now you have to code the additional diagnosis because severe sepsis occurs with an acute organ dysfunction. So you have to specify the which organ dysfunction has happened. Like here they have given a list of additional code like acute kidney failure, acute respiratory failure, critical illness myopathy, critical illness polyneuropathy, disseminated intravascular coagulopathy, encephalopathy, metabolic septic, hepatic failure. So you have to code first the left side followed by the severe sepsis code, and then you have to code the right side additional codes for the acute organ dysfunction. Now you have to remember first some codes which are very specific and which you can come across for coding this DX. Like for streptococcal sepsis, you have to code assign code A40.9. If the organism is mentioned, you can code the specific code like here A40.9. If it is unspecified, you will code only A41.9 as mentioned earlier. For cases of septic shock, the code for the systemic infection should be sequenced first followed by the code R65.21. So severe sepsis with septic shock, we have to code as secondary only. We cannot code as primary. First primary code will be the systemic infection code or code T81.12. If it is post-procedural septic shock, you have to code the T code T81.12. Any additional code or the acute organ dysfunction should be coded as additional diagnosis. And as noted in the sequencing instruction in the tabular list, the code for the septic shock cannot be assigned as the principal DX. So we have already mentioned in previous slide here, like a code from subcategory R65.2 cannot be assigned as principal diagnosis. So septic shock cannot be coded as a principal DX. And sepsis due to post-procedural infection, you have to assign a code from T81.40 to 81.43. Or if it's for obstetric surgical wound, you have to code from 0.86.00 to 0.086.03. that identifies the sites of the infection, followed by the code of the specific infection, A40 or A41 or B37.7. Additionally, assign code T81 if any sepsis following a procedure or a sepsis following an obstetric procedure respectively. So you have to code here for post-procedural infection following these codes. For bacteremia, you have to code R78.81. We have a specific code for bacteremia, so you can use this R code. The term urosepsis is very non-specific term, so it should not be confused with a sepsis code. Only thing it is not to be considered synonymous with sepsis, so it should not be considered same as sepsis because it has no default code in the alphabetic index. So there is no specific code for urosepsis, so you should not go and code a sepsis code for urosepsis. It is mentioned as per coding guideline. If you have any confusion, you can go and raise a query for clarification, but you should not use any sepsis code for urosepsis because it is a non-specific term. So these are all the coding guidelines for sepsis, severe sepsis and septic shock. Please go through all the coding guidelines for coding these codes because these codes require at least minimum 2 codes or more than 3 codes sometimes, depending on the documentation of the medical report. Thank you for watching this video. Please subscribe to my channel and do follow me to get all the latest updates regarding medical coding. Thank you.